So I'm Dr. Partha Pal from Asian Institute of Gastroenterology, Hyderabad, India. My patient care and area of interest includes mainly inflammatory bowel disease and its care. And in inflammatory bowel disease, my area of interest is the treatment of inflammatory bowel disease and diagnosis and monitoring of inflammatory bowel disease through point of care ultrasound, and also treating IBD complications with the help of endoscopic approach. I think this is a very important question because the pathogenesis or how IBD occurs is related to diet, some genetic factors as well as the environmental factors. And among the environmental factors, diet is very important because it can change our bacteria inside of the gut, bacteria or whatever organisms are there inside the gut, that has a direct influence on that. So not only dairy products, I think more important is the ultra processed food. This is very important, avoiding the ultra processed food which is implicated in the pathogenesis or the occurrence of IBD. However, once you develop IBD, if you stop these agents, whether that will cause reduced flare, that is not known, but it is useful. It may be useful for controlling your symptoms, and that is the integral part of the IBD care. Point of care ultrasound is the current IBD physician's stethoscope. Like earlier, doctors used to use stethoscope to see the patient's lungs or abdomen to examine their systems. Like in current era, ultrasound has become the stethoscope of the IBD person, by which we can know your disease is under control or disease is flaring, or we can take management decisions. At all point of time, this is a very useful tool that can use to avoid prolonged examinations like MRI, CT or colonoscopy, and so this is, and patients love it. So this is very important, and that can impact your management in the majority of the patients. Based on ultrasound only, we can take the decisions rather than going for a lengthy procedures like colonoscopy or MRI. Usually the studies have shown, even if you feel well, up to 1/4 or 1/3 of the patient may still have disease in their bowel when we check with ultrasound or endoscopy. So it is important to check whenever your symptoms are not there, but inside the disease may be there, which may lead to flare of your disease in near future. So in those cases also, your scheduled checkup is very important. Also, I think yearly you should check up regarding, because IBD is a pre-malignant condition as well. The colonic disease inflammation can also lead to sometimes malignancy or cancer. So that's why regular checkup and surveillance is important, as your doctor tells. So yeah, that's why you should go. And also, I think vaccination in the patient, whenever they are in the remission period, we take that period for vaccination, and also preventive care, because you are on lot of medications like your bone health and other health, also mental health. All these things can be addressed that time when you are in remission.